Good evening, everyone. Good evening. Good evening. As we are coming into this virtual space, feel free to drop your name, where you're coming from, or where you're from in the chat. We also like to know if you have any type of affiliation, or you are a parent, a birth worker, a mother, however you identify, feel free to put that in the chat as well. We'll get started soon. All right, wonderful. For those who are just coming in our virtual space, feel free to introduce yourself in the chat. You can drop your name, where you're from. And I know that we wear so many different hats. So if you want to share any affiliations or your role, we would love to hear it. We look forward to tonight's conversation. We'll get started in a moment.
All right, hello everyone. While we're waiting, I just wanted to say hello to Jasmine from Philadelphia, Karina, currently expecting her first child, 19 weeks. Congratulations. I'm sorry if I'm mispronouncing it, from Georgia, doula birth worker. Welcome, welcome everyone. Welcome Malcolm from Washington. Patrice is a first time mom, 14 weeks. Congratulations. Abby, student nurse, midwife, and mom. I hope everyone is having a good day today. Miss Tamika's mom and birth worker. Yay. Welcome, welcome.
Yes, it's so good to see this room full with folks from all different backgrounds, different specialties here, moms, first time moms present. A big shout out to the folks in Philadelphia. That's where I am residing from this evening. And Marie, I just want to check in to make sure that we are all set and ready to get started. Excited for our conversation tonight.
We are trying to get two of our panelists in. We're having a little bit of a technical difficulty. If we could just bear with me one more moment, and because giving us the option of converting them to panelists. They came in as guests and is not letting us convert them as we had originally thought.
No problem. We love this world of technology. So folks that are awaiting our conversation, please give us a little bit of grace. We will get started shortly, which will give you all some time if you need a little bit of water or a snack. Feel free to grab that. And for some, I know you might be coming in on the West Coast, so feel free to get some coffee or some tea as well. We're looking forward to tonight. And as we're waiting, since this is the first day of Black Maternal Health Week, we are so excited about that. Tell us how you're celebrating. What are you doing? How are you drawing awareness? Feel free to share that in the chat with us tonight. Oh, Brittany, I see your hand up. Feel free to unmute yourself.
I am so sorry. I think my daughter just walked in and raised hers and it responded to it. I'm sorry.
No problem. Hi to your daughter. I'm looking at the chat here, and someone said, and I resonate with this, talking about it all day long with anyone that will continue to listen to me, attending every seminar I can, prepping for a training with my birth work. Amazing. I love to hear that. And I feel the same talking about Black maternal health ad nauseum, I always say. So Abby says that I'm celebrating Black Maternal Health Week by attending some awesome events like this one. Thank you, Abby, for joining us. And feel free to jump.
I'd love to add as the first day, with the theme being our bodies still belong to us, reproductive justice. I rested today. I took today as a self-care day and to rest because I think so many of us as birth workers and mothers, we do so much, we're always in go mode. So I said, I'm going to kick it off by listening to my body and resting. And I'm glad I was able to get in.
Yes, it's so important to have that rest. Thank you, Nubia, for sharing that. I see also in the chat chiming in, I see spreading the word from Malcolm. Hi, Malcolm. Karina says that I'm celebrating by educating myself and taking advantage of all the workshops being offered. Yes, thank you for joining this one.
And I think we've got everyone here. And so we are good to go.
Amazing. And I see Jay has come in as well.
Yes, I just promoted her to panelist.
Amazing, amazing. Okay, we'll get started. So everyone, thank you so much for being here this evening. I know for many of us, this is dinner time. This is that evening time, and I always call this day Friday Junior. We are at the brink of the weekend, so we have to celebrate that. But most importantly, we are so excited this evening to celebrate Black Maternal Health Week. This session of the virtual series is Birthplace 411. I love that title. Makes me think of back in the day. What's the 411? A frank discussion on birthplace options. And really, our objective and our goal tonight is to talk about the education for parents, for birth workers, for anyone that is interested in pulling up to this conversation, which are so many of you this evening, and talking about the various birthplace options, birth space options that are available to everyone, and really just thinking about how to get all these different experiences and think about how they can turn into positive outcomes, most importantly. So how can we advance birth equity and birth justice through all of these wonderful outcomes that will be shared by our expert panelists tonight? It really makes me think, and a lot of you all have put this in the chat, but really feeling empowered by these choices and the different facilities that we'll discuss, whether that would be home or giving birth at a hospital and everywhere in between. So we'll get into the conversations tonight. I also want to say, and not forget this part, that there's been a really wonderful collaboration that has put this together for us. So I'm excited to just announce that Safer Births Now is a coalition between Black Coalition for Safe Motherhood, Melanated Moms, and we have Jay Wilson here, who will be representing Melanated Moms, the illustrious group. And then we have Dr. Shalon's Maternal Action, as well as Birthing the Magic Collaborative. So really wonderful, 4 great organizations that has put this, not only today's session, but over 15 sessions between now and the 17th together for us for Black Maternal Health Week. So I just want to share that note of appreciation. So if you have just come into our conversation, please, please, please feel free to introduce yourself in the chat, share your name, share your affiliation, your background. I know a lot of us are sharing if you're a parent of how many children, and we have new moms in the house as well. And then also just some housekeeping. We will take some time for some question and answers at the end of the session with our panelists. And as you all can see, we are recording this, so you will have the opportunity to view it again and to listen back. And then also, of course, in respect to our panelists, we just ask everyone to stay muted for the time being until our question and answer session towards the end. So with that, we'll get started. And I'm so excited to be here. Just backing up a little bit and taking about 10 steps back. My name is Christine Ivory. I'm the founder and CEO of Public Health John LLC, which is a consulting, coaching, and community convener housed in Philadelphia, but with an arm that reaches everywhere. I'm also a program officer at the New Jersey Healthcare Quality Institute, child health adjunct professor, as well as a podcast host for Public Health Gem. So a lot of different hats, as I mentioned at the beginning of our conversation. I'm joined tonight with Charity Thomas, with Nubia Earth Martin, and Jay Wilson. I'm so excited to talk to these subject expert matters in their fields and to just hear from them about all these different really great points that we'll bring out with tonight's conversation. So as we get started, I want to pass it back to our panelists first. And if you all could just introduce yourself, that's number one. And number two, I think Nubia, you might have mentioned this at the beginning, but the theme for Black Maternal Health Week is our bodies still, in capital letters, I have to say that loud, our bodies still belong to us, reproductive justice now. So I want you all to introduce yourself, and also with the theme of Black Maternal Health Week, what does that mean to you with this theme of this year, and how do you incorporate that into thinking about those birth options for Black moms and babies and birthing people? So who should I start with? Let me see. I'm going to go to Nubia because you gave us some really great information about how you rest and how you are just putting that and prioritizing that with the theme. But if you would like to introduce yourself and tell us more about what that theme means to you, we would love to hear it.
Sure. Thank you so much for having me. My name is Nubia Earth Martin. I am the president and founder of a nonprofit organization, Birth from the Earth, Inc. And I also sit on the board for the Black Coalition for Safe Motherhood, and myself and Dr. Leslie Farrington co-wrote the ACT curriculum. And, for me, this theme is really about just reclamation and restoration of what's always been for women of color, and kind of getting back to some of those rituals and customs and the type of care that we received that had us thriving, even in the harshest of conditions. And I truly believe that when we embrace that and reclaim our bodies and ourselves and our knowledge and our wisdom and ancestry, we can absolutely turn this maternal health crisis around. And that starts with each of us and conversations like this. So I'm extremely happy to be here with the other panelists and happy to hear how they're centering this theme as well.
Absolutely. Nubia, thank you so much for sharing your introduction. I want to pass it over to Jay next. If you could introduce yourself and tell us what the theme of Black Maternal Health Week for this year, what it means to you.
Thank you so much. I appreciate the opportunity to be on this great panel today. My name is Jay Wilson. I'm the founding president and CEO of Melanated Moms. We are a mom profit, not a nonprofit. We're a community-centered women empowerment organization that primarily creates work around creating maternal health equity, and that's through community engagement events, that's through public policy awareness and education, through advocacy. It's also through understanding what the community needs and helping them to find the spaces and the pieces that they need in order to thrive. Our main goal and mission is to help our moms and birthing people become better versions of themselves, and whatever that looks like, right? So if that's going back to school, if that's finding community, if that's getting involved in advocacy spaces, if it's starting a business, we want to be there to hold your hand and be a part of that success with you, and help eliminate what isolation does to moms, women, and birthing people in their journey to parenthood and motherhood. What does this mean to me? It means so much to me. Understanding that reproductive justice is not just about having a baby, being pregnant or postpartum, or all of the things that we are going to discuss, but it's really about understanding autonomy in your body and the way that it feels, and also the way that you teach your children of how to care for how to care for themselves and their bodies. For me, I have two girls, so it's very important for me to continue to have these very candid conversations about being protected, understanding their body and their functions, and when and if they are ready to go into parenthood as a part of their journey into adulthood, they know what questions to ask, they know how to push back, and they also know how to advocate. Thank you.
Jay, thank you so much for that introduction. And it's so great to hear about that upstream approach of thinking about your daughters and the next generation as we think about maternal health and that reproductive justice lens. So next, I want to pass it over to Chastity, Charity Thomas tonight, and feel free to introduce yourself and tell us about what this theme of Black Maternal Health Week 2024, what it means to you.
Hi, everyone. Yes, my name is Charity Messiah, and I am a registered nurse of 20 years. I'm a doula, and I'm also a lactation specialist. I have CEO of Yaya's Birth and Beyond. We're located here in Arizona, and I focus primarily on postpartum doula support and advocacy and education. And with my nursing experience, I help my clients and families to navigate through the healthcare system, especially when they're birthing in the hospital, and teaching them how to speak up for themselves. What this year's Black Maternal Health Week means to me is also providing education to my community and also my daughter who's in her 20s, and to just help her to get her body ready and take care of herself, not only before getting pregnant, but after. We're doing and after. So I'm also incorporating some of that self-care and rest this week, and I'll be joining more webinars and sharing information with the community on this special time. I'm complete.
Amazing. Thank you so much for your work around empowering voices in these spaces. So great to have you here as well. So thank you, panelists, for your introductions. We're going to jump into some questions. So as I mentioned, the title and the theme of our gathering tonight is what's the 411 around birthing options, right? So we definitely want to jump into that. So could you first help us to understand birthplace options? We know that there's the hospital, the birth center, births at home. If you could just share some insight into your experiences in some of these birth spaces and just give us some of the characteristics of these options. Do you have any type of stories or anecdotes that go along with these birthplace options? So first, I want to pass it back to Charity, and could you share a little bit more about some of the birthplace options and spaces for women in birth and people giving birth?
Yes, I would love to. I'm so thankful to be talking about this. And I worked in a hospital. My experience was two emergency C-sections in the hospital, which is very different. And I also help my clients with home births, where you have, like a little bit more freedom of your environment and a little bit more control over your visitors and who you have as your support team there with you. You have a midwife and a doula, and it's more kind of relaxed. If you do a home birth, more of my clients, they are natural and they're going through the different positions and natural things that you do before you have a baby. And I also am a birth assistant at a birthing center. And so that is also quite different than being in a hospital and at home, where it's you have a little bit more control over your environment, but you still have the midwife there, and they have certain procedures and things that they do, and they can give you medicines, and you can also have a natural birth at a birth center. So you really want to keep in mind what you desire. If, some of my clients, they are absolute on having an epidural, well, that means you will want to look towards having a hospital birth. If you're more so inclined of a natural birth, if you're medically stable and not high risk, then a home birth, along with the approval of your midwife or your OBGYN, would be a perfect option for you. So I just love all the different options that we have. So I always just encourage my clients and their families to think about what they desire, how much control they want. Um, they want to be able to feel comfortable, safe, and secure. So that's those are some of the things that I just, put into the plan for them.
Amazing. Thank you for bringing out desires and the preferences of your patients and clients that you work with. Next, I want to go to Nubia and hear about your experiences in different birth settings. And if you could just give us some characteristics or if you have any stories to share about one or all.
Sure. So I think for me, my personal birth experiences kind of informs the type of, care and work that I do presently. So I'm a mother of five. I had my first two in hospital setting and then went on to have three amazing home births with midwives, which ultimately catapulted me into birth work. So I started as a childbirth educator, really just educating people about their different options and choices, and then went on to become a birth companion and got to attend births in a variety of different settings. So when people reach out, now and they want to find out where's the best place for them to give birth, I want them to really explore what's the most important to you. Like, what do you value? The same way that, Charity just spoke about whether you're high risk or whether you want an epidural and pain medication, and, kind of talking to them about the options based on where they live and what's available to them. And then if they're deciding to birth in a hospital, telling them about the stats for that hospital. What's the C-section rate? Does that hospital have midwives on staff? Because it's shown that when hospitals have midwives on staff, they have lower C-section rates. So when there are no midwives on staff, they tend to have higher C-section rates. Are there birth centers in your community? Are those birth centers that are freestanding or connected to a hospital? And what do those things mean? And then for home birth, which is where my heart is, and that's, the births that I attend with my co-midwife, they're home births. In those settings, it's really about, having kind of dominion over your birth and what you'd like to happen, and knowing that your midwives and your birth team are stepping into your sacred space. So thinking about, what do I want this birth to look like, smell like, sound like, who's going to be present, and all of those things. And, I find once people have factual information, they can make an informed decision. And we want them to make decisions based on facts, not fear. So a lot of the times, people hear myths about all the different, locations, and that's where they're making their decisions from. But we really want to give people that information so that if they have questions, they can kind of think it out, talk it out with their partners, their family, their birth team, and pick the best location for them.
Amazing. I love how you also mentioned about visioning what birth looks like to you. So before you even get there, who's present? What does it look like? What are all those components? So that is amazing. Jay, I want to pass it to you as we think about different birthplace options and just how you would categorize some of these options and any stories that you could share around it.
Yeah, absolutely. So I think the first thing is to really understand your health history and how that can impact your birthing plan, and how that also is a contributing factor to where you can safely deliver. For me, I'm a four-time survivor of preeclampsia, and going through those experiences, I asked a lot of questions. I had a lot of desires, but because of the detriment of my health during my pregnancies, some things were very limited for me. At this space in my life, I'm not having more kids, but at this space in my life, the information I've been able to attain, I now have the ability of saying, okay, I understand how I can be a part of making those decisions. But again, it starts with me understanding my health, and it starts by taking the time to research the type of medical providers who can also serve the different complexities of care that you may or may not have, right? So that's the first thing, absolutely knowing your history. Second thing I would say is actually including your family or your community who is going to be supporting you during that pregnancy and postpartum, so that they also understand and can support the decision that you want to make. If you want to have a home birth, if you want to have a birthing center birth, if you want to go into the hospital, or any place in between, right? Because we all know we can plan as much as we want, but babies will come when they're ready to come, right? So having that conversation and being inclusive with your grandparents, your parents, your partner, and whomever is going to be a part of helping you be a part of that village to get to that final goal. And then lastly, really understanding how your body is changing and how that also is going to impact the things that you need during your birth, right? So some people may be very comfortable with saying, I don't want to have any pain meds. I want to go completely natural. I want to do all of these things. And then they get to a point where they may change their mind. And they're like, oh my God, those things aren't even available here. What do I do? Is that going to change my birthing experience? Is this going to create trauma? Right. So just being aware of how all three of those things really contribute to the final decision that you're going to make. And just knowing that as you're going through those processes, these things can change. Because like I said, babies will come when they come. So just being open and flexible to that is really what's going to help to guide your decision to wherever you do land.
Absolutely. And I really resonate with your mention of the support people in your life, the people that are close to you, letting them know about your birth plan, letting them know about what's going on and what your birth will look like. And I always call that our tribe. So I love how you said the village and just setting the tone for that. So on our next question, and Nubia, you gave us some really great insight to start us off here, but we know that with all of these different types of ways you can give birth and where you can give birth, there can be misconceptions and myths. So can you all share on different types of common misconceptions around giving birth at different centers and different places and spaces, and how can we address them? And I'll start with Charity for this one.
Yes, one misconception that I often face is with my clients and their birthing plan once they go to the hospital, that it will be followed step by step directly, as they have it planned out on the nice, beautiful forms that they give the nurses that's taking care of them. I also like to, along with that birthing plan, and some of us the nurse may have time to, adhere to it, but it's also important that your family member or your support team, your village or your tribe knows your desires. So in case that you can't, verbally speak in the time of a contraction or something may be going on, they still can follow your birth plan. So although you did give the nurse your birth plan, if you was to have a hospital visit, make sure that someone or you are able to voice your desires also and not just depend on the staff to adhere or go by your written birth plan.
Absolutely. Having those advocates and those support team is so important. Thank you for sharing that, Charity. I want to move to Nubia next with this question. Can you share about any common misconceptions and ways that we can address them?
Sure. So one of the things that I hear all the time when people are considering a home birth, they're like, well, I would have done it or I thought about it, but my apartment is so small. And I'm like, is it bigger than a hospital room, right? Because you don't need a lot of space, to have a home birth, and just kind of normalizing like how the mother is monitored, during the home birth, that there's still like checking in on her vitals, they're still listening into baby. And then telling them realistically what are some of the things that could occur that would facilitate or necessitate a transfer, to a hospital, and what that would look like. The other thing that I like to inform people if they're considering birthing in a birthing center is that most birth centers will not allow VBAC, so a vaginal birth after cesarean. So that kind of rules out that option. If you're carrying twins or if your baby is in breech position. So these are things to think about and consider. And then there are some hospitals that, are more VBAC friendly, some hospitals that perhaps do have providers on staff who will do a twin vaginal birth or a twin breech birth. And if you're considering a home birth, so also think about the skills of your midwife. Does she have those, skills? Will that change the course of things? I thought about that when Jay was talking about, preeclampsia and how that, changes the trajectory of a pregnancy and the management of it. So a lot of the work that we do is very much on preconception, prevention, and holistic based. So I've done extensive research on preeclampsia and the things that can actually prevent it. I know we have a lot of resources out there on the warning signs and what happens once somebody develops it. But we also talk a lot, in the preconception in the early, first trimester of pregnancy about what the body actually needs to prevent preeclampsia, but also the other things that can complicate a pregnancy and, kind of risk you out from birthing outside of the home. So things like anemia, high blood pressure, gestational diabetes, and all of these things can be prevented with a holistic approach. It just takes that knowledge and a provider that understands that. So that way all of the different options are available, to somebody, and it's not about them risking out, but it's more about them understanding what would interfere with that birth option that they chose.
Thank you, Nubia. It's so important to think about those considerations for birth. And I want to go to Jay next with this question regarding misconceptions and how we can address them.
Yeah, I think one of the most common misconceptions that I've encountered is moms are birthing people who have gone through either induction or emergency C-section, right? So whenever you're in a space where the baby has distress or there's a sudden change that is creating more complications for the birth to be safe, we do want our medical providers to be able to make quick decisions that's going to make sure that us and our baby is safe and we're able to get to the other side. Sometimes there's guilt, sometimes there's shame, there's this a lot of fear that comes with having to make such a quick decision. And sometimes women have regret of, oh man, maybe I should have pushed back, or maybe they were just trying to push me into it. I think it's really important to know that while those things can definitely occur, the best thing that you can do is make a decision with the information that you had in that moment, and know that you didn't make it out of fear, you didn't make it out of coercion, but you made it because that was the best way that you can ensure yourself and your baby's life was going to be saved. You should not be ashamed of having to have a C-section. You should not be ashamed of having to be induced. For me and my experience with my children, I was induced with both of them. I had very severe preeclampsia. I knew I was really, really sick. And when I got to 37 weeks in one day with both of them. And my last daughter, my youngest, I knew I was really, really sick a few days before I actually went in. And I kept it to myself, like, I'm not going anywhere until I know my doctor is going to be there. Because if I don't, someone's going to make me do things I don't want to do. And I knew that my relationship with my doctor was really important. And he really empowered me to, use my voice and to be comfortable with the care that he provided me. But I knew that he was going to induce me. As soon as I came into his office, he's like, why are you here? We're going to the hospital. We have to get this baby out. Right. So I had to trust that his decision was not just out of convenience, but it was because he and I had a great relationship. He also integrated me in my care, and he gave me the information that I needed to trust that, yes, this is the next logical step. I have a mom that just recently had a C-section, and she had all of these great plans and was, very adamant about having a vaginal delivery and no pain meds, and it didn't go that way. And she was faced with a situation where the baby passed meconium, and they had the conversation with her and said, we want to respect your wishes. We absolutely do. But we think this is the best decision to make sure that you and your baby are going to be okay. So just having that conversation with her, including her in that piece, made her feel way more better about having a C-section, and then, having to process those things after the fact, but knowing like she shouldn't be ashamed. She shouldn't feel upset that she wasn't able to complete the process in the way that she originally planned.
Phenomenal information. And I think that it really just highlights the importance of that trust factor with that patient to provider. It really just highlights that and centers that here. So thank you so much for sharing that. I wanted to springboard right off of what Jay said, because it was one of my next questions, and we touched on it a bit too. But how can birthing people, parents, how can we decide about the best birthplace option for mother and baby, or birth in person and baby? And are there any specific risk or benefits associated to giving birth in these different facilities versus home versus a birthing center, that you all could share? So I know we talked about preeclampsia and gestational diabetes and some of those risk factors, but I wanted to dig a little bit deeper into this, and just think about it a little bit more granular. Um, Charity, can you bring out some information on this a little bit? Just thinking about the best place. How would a birth in person decide?
Yes. So as we mentioned before, one of the things you want to be sure is be knowledgeable of your health and your risk. So of course, a home and birth center would not be the most appropriate place to birth if you are at high risk. And this is also something that you want to discuss with your doctor or your provider to see, make sure that the hospital where you want to go to located, that they are able to assist you there. So you really do want to know your risk factors and discuss the birthing options with your provider before that time comes. Have that inside of your birthing plan. Because one of the benefits, and I see a lot of hospital births there, especially if you're high risk, then you have the immediate attention that you need there. Or if you have preeclampsia or a bleeding disorder, clotting disorder, anything, you want to be sure that there's life-saving equipment around and what's best and safe for you and the baby.
Amazing. Thank you so much for sharing that. Nubia, did you want to give a little bit of information about your thoughts on birthplace options in choosing the best for that birth in person and parents?
Yeah, sure. I mean, I think the best thing that can be applied for all the settings is to use ACT, which is an acronym. It stands for A, ask questions until you understand the answers. So Charity was just speaking about that. What are my risks? What can we do about those risks? What happens if this occurs? And talking those things throughout the course of your prenatal care. And you're asking questions so that you understand the answers and then can make a decision based on that. And then claiming your space, right? So when you're there with your provider, I heard Jada speaking about her provider being excellent and really adamant about her and her baby. That's important, right? So when you're there with your provider, if they're kind of not paying attention, or they're asking the same questions over and over again, and you know that you've gone over this at previous visits, you really want to ask yourself, is this person censoring me and my baby and my care? And then, trusting your body. So Jay also spoke about that, like knowing something was wrong, getting in contact with her doctor so that, interventions could happen so that her and her baby were going to be safe. And that goes both ways, trusting your body when you know something might be off, but also trusting your body and I'm okay. And I would like to continue, with this natural physiologic birth plan if we're able to do that. And the last thing is going to be telling your story. So the more that, we hear these positive birth stories and positive exchanges between our providers, and other families can hear that, that's going to help to inform where they decide to give birth as well. I think we hear a lot of horror stories and we hear enough of narrative, about Black women dying, but there are many positive stories that happen in all three of the different, possible settings of birth that people need to hear so that they can make a decision based again on, truthful, things that have happened and not, just anecdotes or misconceptions or, possibilities that might not even be a reality.
Absolutely. Thank you so much for outlining ACT. We have to take that, put it in our back pocket, in our toolkit so that we have that here. And I love how you mentioned the power of storytelling and how our voices amplified can make so much change. Jay, I want to move to you with this question as well, thinking about the best birthplace option for birthing people. How can they decide?
Yeah, so just to piggyback on everyone's comments from earlier, trusting yourself, trusting your gut, taking the time that you need to research what it is that you want and what it is that you are expecting to experience during your birthing experience. Also learning about your medical provider and making sure that their clinical decisions or the things that are really important to you throughout that journey, they're actually able to provide for you. Very often you may you're going to book your appointment with one provider, but babies come when they come, so you may actually end up seeing a different provider that's in that practice or in that group. So being very aware of the differences in those medical providers and the way that they provide care is very paramount into going into that decision as an informed individual. I think also what's really important is understanding what your postpartum care is going to look like after you've given birth. And I don't think we spend enough time on really talking about what that support looks like. In my experience, not only did I have the preeclampsia, but I had postpartum preeclampsia for about 6 weeks, almost 2 months after I had my last daughter, and I ended up developing a heart condition. It wasn't just my OB who was a part of my care. He pulled in my kidney doctor, he pulled in a cardiologist. So he created this really great team of people who was able to make sure that I wasn't just being treated for postpartum preeclampsia, but I was looking at all of the other systems of my body that were affected from that birth. And I had adequate care. I ended up having home care, having a nurse that really was able to dive into that with me, lower my anxiety, but also help me to continue to breastfeed my daughter, all of the things, So knowing how all of those things are a part of these decisions that you need to make, and the resources that you also have access to. And lastly, of course, shameless plug, connecting to community resources like Melanated Moms, where we have virtual support groups and we have great partnerships where if we don't provide the service, we can totally connect you to someone else that's in our directory or part of our organization that can do so. So, tapping into all of those things are really what's super helpful.
Absolutely. I agree. I second that, tapping into our resources. And I want to ask about resources before we go. But before I get carried away, I know that there's so many people in the audience right now that want to share back some of the questions that they have for you. So I'm going to take some time to jump into some of the questions that we have. And if you did not have a chance to drop your question, please feel free to drop it in the chat or in the Q&A, those who are joining us. Our first question here, which I love, is how can you advocate for baby and we know that there's so many different health disparities that folks face, whether it's discrimination, racism, all these different isms, right? So this person mentioned pulse ox and GFR and just all these different testings that I know that are coming to the light and being illuminated. But let me take 10 steps back. How can you advocate for yourself and baby is the root of our question. And any panelists, feel free to chime in and add to this.
Yeah, I'd love to say that, there are many things that can impact a pregnancy that they love to say, well, Black women are more at high risk for this, and Black babies, more of this and that. And a lot of these things are connected to stress and how stress can impact a pregnancy. And I love to remind people that just showing up as a Black woman day to day in America can be stressful, right? So we need to be in spaces that allow us to down regulate where we feel safe. We need to be, practicing meditation, breathing techniques, being healing spaces, somatic release techniques, prenatal yoga, so that the safest place for our babies are in our wombs and so they're ready to be born, right? Because when we have adrenaline and cortisol, being thrown at us during a pregnancy, that impacts the baby's ability to receive adequate oxygen, blood flow, nutrients. And this is why sometimes our babies are, coming earlier or are smaller weights, because we're dealing with a lot of stress. So that means that we have to acknowledge the things that are causing stress. For Black women, sometimes she's the head of household. Sometimes she is, the main breadwinner. Sometimes it's all on her shoulders. So what can we do as a community and as providers to take some of that load off of her shoulders? Jay mentioned melanated moms, and she said shameless plug, and I'm like, yes, we should have no shame in sharing all the resources that we have out there for our families, for dads as well, and for getting them involved, and how important their role is in that postpartum period, especially as Jay points it out that she still was dealing with preeclampsia postpartum. We often hear this myth that, once the baby is out, your preeclampsia will be over. And no, we're still at risk for preeclampsia and other things up to 6 weeks postpartum. So that means that it's not just about getting the baby out. Yes, that's important because we don't want the baby to have any adverse outcomes, but it's really about supporting our liver and kidneys, right, which are the two main organs that are impacted by preeclampsia, so that we don't have, prolonged organ, failure and issues and problems. So I think instead of just, thinking, well, I'm high risk because I'm a Black mother or I'm carrying a Black baby, let's look at what's actually happening real time, right? Is my baby growing adequately? Then don't just, diagnose me as I'm probably going to have a low birth weight baby. Let's actually walk me through my journey of pregnancy based on what I'm actually experiencing. And if something is happening, then put me in the place of resources that can help to correct that.
I love to jump on that really quick. The one thing I always tell my moms is you are an advocate even before you know. When you are pregnant, you are already putting that advocacy piece into play. You're changing the things that you eat, you're changing your environment, you're looking at all of the ways that your life is about to shift to bring this person into this world that you have no idea who they're going to be, what they're going to be, or how they're going to change the world. But you know that your actions, your behaviors, every decision that you make up until they take their first breath, it relies on you making informed decisions, speaking up, stepping back, paying attention, taking time to research, right? All of those things are forms of advocacy. So when we think we're not advocates or we need permission or someone has to teach you how to advocate, it's kind of not true. You're already doing it. And the same thing when it comes to fathers, right? So including them in these conversations, telling them, you are supposed to be here. This is supposed to be a part of your journey, just like it's mine. You helped me make this kid, right? So giving them the space that they need to know, like, you don't need permission to be in your purpose and to create the opportunities to advocate for what's needed. What we are doing is we're being more boisterous or bold, if you will, with saying, I'm not going to be silenced. I'm not going to just go with status quo. I'm not going to allow you to erase my life, but tell me that I only count as a metric. I'm going to actually speak up and change the narrative of what it looks like to change things from maternal mortality to maternal vitality, right? So that's how we actually activate people with the advocacy that's already innately within them. And, you know, it really does create what advocacy looks like from a different lens, you know. And lastly, we're giving the space that people need to see people that look like us in those spaces. So we already know this. So many other people will narrate what our stories look like, what our history was, who we are, and our value. But unless we are there to tell our side of the story or to change what they're saying is factual for us, nothing will ever shift, right? So we have to be very confident and I'm just gonna keep saying bold and stepping into that space, because it is powerful. It is powerful for us to share who we are and be out loud with it and not be ashamed by it.
Exactly. If I could just add something also, one way that you can advocate for yourself, and mostly I provide postpartum doula services and support to the community, is advocating for yourself postpartum. It's okay to ask for help. You know, this is where it will also be good to, this is some of support from your friends and your family, or hiring a doula to give you, you know, that rest that you need, and also to help you transition during this very crucial time. So self-advocacy is also a way to advocate for the baby. You take care of yourself, you'll be more amped to take care of the baby.
Look, I got clapping hands. You can't hear them right now, but it's happening. No, but you all are sharing some really great points, and I just love the cross section of how you all mentioned mental health. You know, thinking about how Black women specifically, how the weathering hypothesis, the strong Black woman syndrome, all the things that we've been learning about, and that research has even shared and proved how that affects birth outcomes, certainly has taken a role and taken a place. So taking care of ourselves and activating that advocacy that's already within us. So thank you all for sharing that. I'm going to cover one more question because I see that time is just escaping us, but we have a great question in the chat here. It says, can you talk about the benefit of hiring a doula? And just thinking about that from the context of both in and out of the hospital, what does that look like? So any panelist that likes to chime in, feel free.
Sure, I'll add, speaking about having a doula inside of the hospital, that will be very beneficial, because one thing that you want to keep in mind, you will have nurses and you will have a medical staff with you, but they're focusing, especially the nurse is focusing on your vital signs, looking at the monitors, making sure the doctor's orders are getting checked off, make sure you will have the lab. So what a doula is a non-medical professional that really supports emotionally. They can help you in any kind of way with positioning, and also help you to advocate for yourself. So different things that come up in the hospital, you know, remind you of your birth plan. They can also be there to support your partner, or, you know, your family or your tribe. So just to having that extra support in the hospital is really beneficial to having a doula. Just someone there that can be with you, give you the attention that you need, give you the support that you need.
Yeah, I'd love to add, I recommend having labor support, continuous labor support in all of the settings, right? Because you want your clinical team to be, refreshed and on point to pay attention to, those main things like your vitals and baby's vitals, right? And when you don't have that continuous labor support, it's easy for the midwife to start doing hip squeezes and, other comfort measures, because that's what we do. We see somebody who needs a comfort, we see somebody who needs encouragement, and we want to do that. But the best birth team is going to have, continuous labor support. You're going to have a midwife or possibly two midwives or a birth assistant, so that everybody's kind of playing their role together and nobody's exhausting themselves, and everybody can actually be present in their role, for you. And when you have continuous labor support, it's shown to reduce your risk of having a C-section, reduce your risk of wanting, pain medication, and really being able to honor physiologic birth, which is going to also reduce your risk of any unnecessary, interventions that might cause complications down the line. So I tell people, regardless of where you're going to birth, it's really important. And that person can be, a professional birth companion. That could be your sister, friend, grandmother, as long as it's somebody that you trust. And I think that's really important, that the birthing person gets to choose who that person, is, and they get to build some type of rapport with them. And that person understands what's going to be of comfort to that birthing person because they built a relationship prior to.
I'll add a little bit to that. I think also what's important about selecting a doula is understanding the integrations of identities. So not just having a doula who has the educational background or the training, right? But someone who can like identify with your race, your ethnicity, your culture, your language, all these other identifying factors that contribute to who you are as a person, and also how that relates to your parenting and your family, your community. Another thing that I've been really seeing popping up, which is really great, is doulas having more specialties around the different complexities of care, such as families who have experience in the NICU, or women living with HIV and want to have family planning options. So seeing that these are now areas that doulas are specializing in is creating a different level of support that we haven't always been able to see, and we haven't always been able to explore because we didn't know that these were options, right? So I think paying attention to that, and I just saw in the chat, Miss Layla, she shared that she works with the majority of undocumented people who don't speak English well or at all. So again, even highlighting the importance of language and how much that really helps to translate care literally and figuratively into the way that a person feels comfortable and safe is very paramount. I know in New Jersey, the Children's Specialized, wrong one. Children's Society of New Jersey is graduating. They've graduated several classes of doulas who come from different ethnicities and backgrounds, and they really wanted to emphasize that space of language and culture as a part of the doulas that they're training. So here's the training so that you can, do all of the work around the birth, but also understand how to speak to families who may be from more insulated communities, or may feel that they are not represented in certain types of ways or spaces. So I think that is one of the most beneficial things to having a doula, and also incorporating them into your birthing experience throughout the hospital or even a birthing center.
Amazing, amazing insight from all of our panelists here. Thank you all so much for the questions and thoughtful questions that were in the chat tonight. As we get ready to close, before we do, Jay, Charity, if you all could share any type of resources, and Newbie, I'm sorry, I forgot in my final three, my top three here. If you could share any type of resources that everyone should know before we leave tonight, please feel free to share that, as well as where can people find you, where can people reach you as well? We'd love to know that. So Jay, I'll pass it to you first, and if we could just go through that really quickly before we leave tonight.
Sure. So I dropped in the chat, but I definitely would love to share if anyone is interested and ready to really use their advocacy voice to promote change and to be a part of learning how policy really influences the resources that we have access to. Please take my Find Your Road training. I'll drop the link again so you all have access to it. And you can always find me at melanatedmoms.com or any social media at Melanated Moms, like literally across the board.
Thank you, Jay.
Next. Yeah, sure. So Birth from the Earth is my nonprofit organization, birthfromtheearth.org. You can definitely find a plethora of resources for birthing families, including free childbirth education, village baby showers, Fatherhood Fridays, Chocolate Milk Cafe. And then also for people who are interested in getting involved in birth work, we train childbirth educators, birth companions, postpartum labor support. We have birth assistant trainings. If you are a student midwife, we have holistic midwifery skills. And we have different herbal classes as well. And then the Black Coalition for Safe Motherhood is always a great resource with all of the different acts, scenarios to kind of practice in different birthing settings, and Chocolate Milk Cafe as well.
Yes, I am a postpartum doula at Yaya's Birth and Beyond. It's at Yaya's Birth on social media, and I also offer virtual support. I like to make sure everyone has a resource, Postpartum Support Internationals, and they help with postpartum depression and resources for that, and try to help you with maternal health. And also, with being a former case manager, I always like to let the community know whatever insurance that you have or public assistance, you can give them a call and ask them what resources they have for you being pregnant and postpartum. And most of the time, those are a part of your plan. So make sure you call them and ask what's available to you. It was a pleasure sharing the stage with you all.
Thank you so much. Yes, I have to say that again. It was certainly a pleasure to have this conversation with you all. I want to say a big shout out to Charity, to Nubia, to Jay for being our experts tonight. They just dropped a lot of great information for all of us here this evening. Before we go, I do not want to forget to remind you that we have a virtual series, as I mentioned, so many different sessions to join. Join us tomorrow, 6 p.m. Eastern, for Preeclampsia Perspectives, Insight for Expectant Mothers. We also have Womb Chronicles. And lastly, we have Bump Friendly Beauty, Navigating Pregnancy with Natural Products, all happening tomorrow evening. Thank you again to the panelists for this informed, really great discussion tonight. It really helped and centered birthing people all over, I know. And we just thank you for your work in the field and everything that you do. Thank you all for dropping into the conversation, and we will see you tomorrow, and happy Black Maternal Health Week. We'll see you tomorrow. Bye, everyone.